Good afternoon. I thought I'd take a moment today to talk to you about the COVID-19 vaccination. Not to tell you whether to take it or not to take it. I'm not a scientist, I'm not a doctor, and it's not my privilege to give that kind of information. However, there has been recently phone calls here to the parish at St. Francis Xavier and phone calls up north at St. Ignatius Mission Parish about the morality of taking the vaccination due to a concern about tainted stem cell lines. And that's what I'd like to address. There are a number of moral concerns talking about the vaccinations, such as access to communities of poverty, access to third world. There's a number of other questions, but today I'm just going to mention about the idea of tainted stem cell lines. The U.S. Catholic Bishops' Conference and the Congregation for the Doctrine of Faith have said that through the development of these vaccinations, it is morally acceptable to take the vaccination. That means on your own prayer and in consultation with your own physician, you can decide whether you want to receive the vaccination or not. But one of the issues is the vaccination morally unacceptable? And the answer, according to the Bishops' Conference and according to the Congregation of the Doctrine of the Faith, says that it is morally acceptable to receive the vaccination because of the higher good. The Church isn't so much concerned about each individual receiving it, particularly they want to protect the most vulnerable, but they say that a person who is happy and healthy taking the vaccination shows love of neighbor and love of someone else. As a matter of fact, they have 3 different ways they divide this out. And so let me repeat them. And this is from a document from the USCCB, or so the Bishops' Conference. And I quote them. The current COVID-19 pandemic has created a situation with circumstances similar to those posed by earlier vaccinations. First, at least at present, there is no available alternative vaccination that has absolutely no connection to tainted stem cell lines. Second, the risk to public health is very serious, as evidenced by the millions of infections worldwide and the hundreds of thousands of deaths here in the United States of America alone. Third, in many cases, the most important effect of the vaccination may not be the protection it offers to the person who receives it, who may be relatively robust and healthy and unlikely to be seriously affected by the virus. However, the more important effect may be the protection it offers to those who are much more likely to be seriously stricken by the disease if they were to contact it through contact with those that are infected. Basically, where we're left is this. There is somewhat of a false narrative in certain Catholic circles stating that because of the tainted stem cell lines that the vaccination is morally unacceptable to receive. That theory of thought goes against what the U.S. Catholic Bishops' Conference is saying and goes against the Vatican Congregation, the Congregation for the Doctrine of the Faith. They've both weighed on this numerous times. The Moderna and the Pfizer vaccine both were developed without using tainted stem cell lines. However, in their testing phase, there was a backup test used that had stem cell lines that were tainted. The Church has said that because of the remote possibility and connection to abortion that this line offers, that it is still morally acceptable to receive. The AstraZeneca vaccination, which has not been approved in the United States, has some moral questions to it. And if that is eventually approved in the United States, I think we can relook at this issue along with the Bishops' Conference. But for now, the decision to become vaccinated is yours and yours alone, in consultation with your own physician and in confrontation with your own family. If your priest is telling you to take the vaccination or to not take the vaccination based on a morally questionable stem cell line, that priest, I would suggest, might be incorrect. The decision is yours and yours alone, but please educate yourself on the possibilities. Look at the U.S. Catholic Bishops' website for more information, and also for the American government, the CDC, and for the Congregation of the Doctrine of the Faith in Vatican. Thank you and God bless.